Hello students, my name is Alok Semwal and in today's lecture I am going to discuss about anti-infective agents used in urinary tract infections. The history of antimicrobials begins with the research and observations of Pasteur and Joubert. Pasteur and Joubert were the first scientists who discovered that one type of bacteria could prevent the growth of another. At that time, they were unaware of the fact that several bacteria produces antibiotics, which is the reason that other bacterium is failing to grow. According to a universally accepted definition, antibiotics are substances that are produced by one microorganism that kill or prevent the growth of another microorganism. One another definition states that an antimicrobial is a substance that kills or inhibits the growth of microorganisms such as bacteria, fungi, or protozoans. In a common usage, the term antibiotic is used to refer to almost any drug that attempts to get rid your body of any specific type of bacterial infection. Because of the increasing demand of antimicrobials, several organic compounds obtained by chemical synthesis on the basis of model compounds. So modern antimicrobials include not just antibiotics but synthetically formed compounds as well. These compounds are usually contains useful antibacterial activity for the treatment of several local, systemic and/or urinary tract infections. Several classes of synthetic antibacterial agents include the sulfonamides, certain nitroheterocyclic compounds such as nitrofurans and metronidazole, and the quinolones. Most of the antibiotics are concentrated in the plasma or tissues for the treatment of systemic infections after oral or parenteral administration. However, agents that fail to achieve adequate concentration in plasma or tissues are concentrated in urine, where they can be effective for the treatment of urinary tract infections. Few examples of such agents include nitrofurantoin, which is a nitrofuran, nalidixic acid, which is a quinolone, and methenamine. Quinolones are members of a large group of broad-spectrum bactericidals that share a bicyclic core structure related to the compound 4-quinolone. Nalidixic acid was the first quinolone, which is naphthalene derivative, introduced for the treatment of urinary tract infections in 1963. After the introduction of nalidixic acid, several attempts were made in order to generate various other quinolone derivatives. Isosteric heterocyclic grouping in naphthalene derivatives resulted in the generation of quinolones such as norfloxacin, ciprofloxacin, and lomifloxacin. The naphthalides such as inoxacin and the sinolines such as sinoxin. Till date, clinical usefulness of quinolones is limited to the use of urinary tract infections. However, the use of fluoroquinolones in urinary tract infections is not recommended in children because of various potential adverse effects. Fluoroquinolones are also contraindicated during pregnancy because of potential damage to fetal development. The most frequently used fluoroquinolones include ciprofloxacin, levofloxacin, norfloxacin, ofloxacin, and gatifloxacin. Classification of urinary tract anti-infective agents is divided into three main categories according to the structural features of the drugs. First category is of quinolones, which also includes fluoroquinolone derivatives. Second category is nitrofurans, and third category is methenamine and its salts. Drug candidates in the first category quinolones are nalidixic acid, enoxacin, ofloxacin, norfloxacin, ciprofloxacin, lomifloxacin, sparefloxacin, gatifloxacin, and moxifloxacin. Second category, nitrofurans, is named according to the structural components such as a furan ring with a nitro group. Members of this class of drugs include furazolidine, nitrofurazone, and nitrofurantoin. Third category is of methenamine and its salts. Methenamine is a heterocyclic compound with a case-like structure similar to adamantane. This category includes drug candidates such as methenamine, methenamine mandrolate, and methenamine hippurate. Next is mode of action of fluoroquinolones. It is believed that fluoroquinolones enter the bacterium by passive diffusion through porins present in the outer cell membrane. Porins are a type of protein which are also known as beta-barrel proteins. Porins are different from other membrane proteins and structurally large enough to allow passive diffusion. Once inside, fluoroquinolones tend to bind to the enzyme topoisomerase 4 and DNA gyrase, which are the originally recognized drug targets. Commonly, DNA gyrase is more selective in gram-negative bacteria and topoisomerase 4 is more sensitive in gram-positive bacteria. Drug binding to both enzymes forms a non-reversible ternary complex which inhibits the resealing step, and by initiating DNA double-strand breaks probably initiates cell death. Next is mode of action of nitrofurans. Nitrofurans are acceptors of oxygen, so they hinder the process of cellular respiration of the bacteria. They also inhibit the biosynthesis of nucleic acids. The mode of action of nitrofurantoin is unique in the sense that it is reduced by bacterial flavoproteins into highly reactive electrophilic intermediates. These intermediates attack bacterial ribosomal proteins non-specifically, causing inhibition of bacterial ribosomes and other macromolecules. Generally, protein synthesis, aerobic energy metabolism, DNA and RNA synthesis, and cell wall synthesis are inhibited. Last one is mode of action of methenamine. Methenamine is a urinary antiseptic which is hydrolyzed at a low urine pH of 5.5 or less into formaldehyde and ammonia. Formaldehyde, being toxic to most of the bacteria, not only causes antibacterial but also antifungal effect. Thank you.